thank you to the Health Research Board for the opportunity to speak with you today. I'd also like to acknowledge the humbling experience that it is to speak after Sir Ian Chalmers, who has had and continues to have a profound influence on the lives of many people, and certainly on my thinking over a long number of years. Thank you, Ian. What I'd like to talk to you about is thinking critically about health claims for the next 20 minutes or so. Just some disclosures, although I'd like to think that I've made choices based on reliable information always, I'm confident that I've been duped more than once. My team and I work to help find solutions to how best to think critically about claims, for example, in work we do in the Health Research Board Trials Methodology Research Network, in Evidence Synthesis Ireland and Cochrane Ireland, and in our work around iHealthFacts.ie. This talk today leans heavily on some of our work, and in particular our work with our colleagues in the Informed Health Choices Initiative, which I'll speak to later. And lastly, I think we all have a role in promoting an informed public. I include myself as having a role there, and I also include myself as a member of the public who needs to be informed. Good health, we know, and healthcare depend on people making well-informed, rational decisions about their health and the health of those they may care for. These decisions depend on several factors, including the availability and the accessibility of trustworthy or reliable information about the different options from which they can choose. However, many people feel overwhelmed by information, particularly about how they can improve or protect their own health or the health of those for whom they care. We also know that health information spreads faster and further through multiple interconnected channels of social media, television and radio, the traditional print media, and of course, mobile messaging services. Indeed, the rapid global spread of COVID-19 has been accompanied by what the World Health Organization has described as a massive infodemic, and many of you will have heard and used this term over the past few months, originating, of course, with the previous SARS epidemic. So an infodemic is an overabundance of information, some accurate and some not, that it makes it hard for people to find reliable information when they need it. A lot of the conversations today in the context of COVID-19, we talk about something being, lots of things being unprecedented. And certainly that is the case. But it's also important to look back and see how these same concerns and issues have been raised at many points throughout history. For example, the Dublin-born Jonathan Swift said, "Falsehood flies and truth comes limping after it." And why might this be the case? Why is misinformation so darn adhesive? Why does it stick so well? There are many reasons, and one of those is that misinformation often relies on, for example, sensationalized headlines to help it on its journey. Another is that misinformation is often repeated again and again and again through those channels we spoke about. And simply having heard a claim repeated makes us more likely to think it's true. And we can see analogies in this in what we might call old wives' tales, myths, or folklore. So, for example, the Irish Folklore Commission Schools collection consists of 750,000 pages of folklore and local tradition collected by 50,000 school children from 5,000 schools in the 26 counties of the Irish Free State between 1937 and 1939. It's a fascinating and rich collection of folklore. And one remarkable thing for me in this is the consistency in local traditions or folklore across the country. This is particularly evident for me in some of the examples of cures for various forms of conditions or ailments. So most of us, certainly in Ireland will be familiar with the use of dock leaves as a treatment for nettle stings, and that certainly is ubiquitous within this particular collection. But other claims have stood the test of time less well. So, for example, a cure for whooping cough within this collection is noted to pass the affected child in and out under a grey ass 3 times, then get the ass to chew a piece of loaf bread, and before he swallows it, take it from him and get the child to eat it. So perhaps less whooping cough and probably less availability of donkeys in Ireland relegates this claim to the collections of memories only. But more seriously, there have always been health claims, and there always will be health claims. Some stick better than others. However, the difference today is the multiplier effect that social media has on making the spreading of misinformation or unreliable claims much more easy. It's effectively the supercharged old wives' tales or folklore. So, for example, in early March, this photo was circulating on social media, suggesting that Vladimir Putin had released around 500 lines in the streets of Moscow to strongly encourage people to remain indoors during the pandemic outbreak. Of course, that wasn't the case, and indeed this photo isn't even in Moscow. The serious side of this, of course, is that many health claims were made during the COVID pandemic, and some of these have caused serious harm. So many of you will be familiar with examples such as this. The destruction of a mobile transmission tower because of, it was thought, concerns that these towers may have been transmitting or responsible for coronavirus transmission through the 5G network. Of course, we've had claims, as you well know, that sunlight might kill the coronavirus, and suggestions as to how that sunlight might be administered to human beings. And the claims around the diagnosis of COVID-19. So the bottom right of your screen there, which is looking at taking a deep breath and holding your breath for more than 10 seconds. And if you can do this success without coughing, without difficulty, it shows that you don't have the coronavirus infection. So this infodemic affects lives, and people need reliable information so they can make decisions to protect themselves, their families, and their communities. And in an infodemic, people are exposed to spread and some act on unreliable claims that, for example, COVID-19 is a bioweapon, can be treated with ingestion of bleach, or can be prevented or attenuated or weakened by various drugs, potions, and actions. By way of example, in April of this year, the US Food and Drug Administration advised that it had received reports of several people experiencing life-threatening adverse events after drinking chlorine dioxide products arising from misinformation. At the individual level, mistaken trust in unreliable claims and misinformation can and has resulted in avoidable harm, including death. So, for example, patients with cancer who delayed or declined conventional cancer therapy in favor of alternative therapy are more likely to have worse outcomes, as reported by Johnson et al. And the effects of the COVID-19 infodemic aren't just limited to health. They've led to an unleashing of what the United Nations have termed a tsunami of hate, xenophobia, scapegoating, and scaremongering. And we will be aware of the anti-foreign sentiment that surged online and in the streets, as reflected in this piece by the Secretary General of the UN. And While it may not be possible to change the amount of information available, improving critical thinking about treatment claims, comparisons, and choices may help people determine and act on trustworthy information or claims and not act on those that are not trustworthy. And one framework to help us do that is the Informed Health Choices Initiative. So this is an international collaboration of researchers led by a team in Oslo. The founding members are Dr. Andy Oxman on the left here, and our previous speaker, Sir Ian Chalmers, and other colleagues. It's a large international network of people who are working together to try and promote critical thinking around health claims. The Informed Health Choice Initiative uses evidence-based key concepts that help people think critically about health claims and make informed choices. The key concepts themselves help people recognize when health claims, and that is the effects of doing or not doing something, are made, to assess the trustworthiness of the evidence used to support the claims, and to make well-informed decisions in choosing what course of action they want to pursue. What I want to do is focus on a number of those key concepts during this presentation. So I'm going to focus on 4 of the 49 key concepts, and they are: competing interests may result in misleading claims, personal experience or anecdotes alone are an unreliable basis for most claims, comparison groups should be as similar as possible, attention should focus on all important effects of treatments and not on surrogate outcomes. So the first of these key concepts, the competing interests may result in misleading claims, or the as advertised principle. The picture on the left is still from the commercial advertising the anti-inflammatory drug Nurofen, which was banned in the UK for falsely claiming that it could specifically target joint and back pain. The second picture from Danone, it relates to a commercial that stated that Activa, eaten every day, is clinically proven to help regulate your digestive system in 2 weeks. Regulators later concluded that the commercials and similar claims on Activa packages were deceptive. Kellogg's haven't been immune to this either. So Kellogg's voluntarily discontinued health claims about the effects of their cereals on children's immunity following concerns that had been raised by regulators. So we need to be cautious that something that is advertised and where there certainly is a competing interest may alter what that advertising message is. The second concept I want to look at is personal experiences or anecdotes alone are an unreliable basis for most claims. The principle that it worked for me. Many people, certainly in the part of the world that I live in, use copper bracelets to help treat the symptoms, certain pain in particular, associated with rheumatoid arthritis. There is little evidence to support its effectiveness, and what evidence is available demonstrates that wearing a magnetic bracelet or copper bracelet does not appear to have any meaningful therapeutic effects beyond that of a placebo for alleviating the symptoms in rheumatoid arthritis. So it's about, just because a treatment works for you or someone you know, doesn't mean it will work for someone else. There are lots of other factors that may have contributed to this particular intervention working. The third concept is comparison groups should be as similar as possible. And we're concerned here if we see dissimilar comparison groups. We need to watch out for comparisons of different treatments where those comparison groups are not alike. For a comparison of treatments to be fair, the people in the comparison groups should be as similar as possible at the start of the study. Were they not similar, it's hard to know how much of a difference in what happened in the two groups was because of that, and how much of it was because of the treatments that they were compared. So, for example, if people themselves decided whether to use a treatment or not, the people who choose to use the treatment may be sicker or may perceive themselves to be sicker or healthier than those who choose not to use it. This could make comparisons of the effects of the treatment really difficult and impossible to know whether the treatment is having a better or worse effect for individuals. The best way to make sure that people in the comparison groups are alike is to decide who gets which treatment by chance, that is randomly. So something like pulling the names out of a hat or flipping a coin. And what you're trying to create in that circumstance are groups that are indeed alike in everything except the treatment that they received. So any differences in outcome between the groups can be attributed to the intervention that one or more of the groups may have received. The fourth key concept I want to talk briefly about is attention should focus on all important effects of treatments and not just surrogate outcomes. And that is about what outcomes matter to you. What expectations do you have? A fair comparison may not include all outcomes, short and long term, that are important to you. Patients, professionals, researchers may have different views about which outcomes are important. So, for example, if we look at this study on the use of apple cider vinegar for the reduction of weight. So if we look at this particular study, Japanese study, the abstract of that paper concludes that body weight, visceral fat area, waist circumference, and serum triglyceride levels were significantly lower in both vinegar intake groups than in the placebo groups. In this particular study, they allocated people to a low dose of cider vinegar, a higher dose of cider vinegar, or to a placebo. But when you bury a little bit deeper into the study, you find the results of the present study show that in obese Japanese subjects who had BMIs ranging from 25 to 30, body weight and BMI were reduced by 1 to 2 kilos and about 0.4 to 0.7 points. That body weight reduction of 1 to 2 kilos was at 4 weeks after a 12-week treatment. So whether or not 1 to 2 kilos over that length of time would be important to you is important to know. What is clinically important or important to you as an individual might be different to something that might be statistically important, which is another of our key concepts. As I mentioned, these key concepts are taken from a suite of key concepts developed by the Informed Health Choices group. I do encourage you to visit the group's website, check and see what they've done. In particular, look at how they have demonstrated that it is not only possible, but successful in teaching children how to think critically about health claims using these key concepts as the basis for an intervention in primary schools. It's well worth looking at, and all of the key concepts are available there. That brings me to the end of my talk. I just want to thank the organisers again for inviting me to speak with you here today. And I'd also like to thank the PPI Ignite group in ANUI Galway, and particularly Deirdre and Anne, for having worked with me in prioritising which of the key concepts might be useful to share with you here today to give you a flavour of the utility of the key concept as a framework for thinking critically about health claims. Thank you.